So someone wanted to know about how we're going to use tortuosity in neuro-ophthalmology. And you can watch the video on the optic nerve tortuosity. That tortuosity is necessary so you have play in the system so that you don't go blind every time you look to the right or left. So you have to have some play in your optic nerve when you're looking around. But in arteries and veins, we have remodeling that can occur. And so vascular remodeling occurs in response to ischemic stimuli. So the ischemia is the drive for the remodeling. And so the closest point, of course, between 2 points A and B is a straight line. And so if the chord length and the arc length are the same, there's a 1.0. However, if you put more artery and more vein inside the same distance, that's going to increase the surface area of the vessel within the same area if the area is held constant. And so tortuosity is your body's way of putting more vessel in the same unit of area. And that's why it's a marker of ischemia. And so when we look in the back of the eye and we see dilation and tortuosity, it is a response to ischemia. The dilation is to bring more blood flow. The tortuosity is to bring more blood vessel. And so in patients who have had previous central retinal vein occlusion, the vein might be dilated and tortuous. The other thing that happens with tortuosity is increasing the pressure inside of a tube that is not rigid also can cause it to be tortuous. So normally you would think it would just dilate. If you just increase the fluid, it just get bigger. But because these systems, the pressure is not felt the same across the wall, it causes buckling. So in the places where the force is more, the wall will buckle. So even just increasing the pressure in a vein from a vein occlusion without the remodeling time, like it happened yesterday, also causes dilation and tortuosity because you have an obstruction. So both in the acute central retinal vein occlusion and in the chronic central retinal vein occlusion, we have dilation and tortuosity. In the acute phase, however, because you have an obstruction in the vein, all the blood will come out. And so when we're looking at a CRVO, there'll be 4 quadrants of hemorrhage. And the edema will appear under the macula. So you'll have macular edema and disc edema because the blood can't get out, and so the water stays in, and that water in the tissue we call edema. So macular edema, disc edema, venous dilation, tortuosity, and 4-quadrant hemorrhage is what we see in central retinal vein occlusion. You should now know that tortuosity can be a chronic response to ischemia, that's vascular remodeling, or can be a direct pressure response with dilation and differential buckling in the wall in an acute CRVO, as well as in the chronic.